is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast, and we are starting 2023 off right. We get to chat with one of my favorite humans in dentistry, Dr. Scott Parker, who I have the pleasure of calling my friend, but also a mentor, because he's taught me a thing or two about lasers, a lot of things. And he gets to share that awesome knowledge with all of you guys today and ladies. Um, Even though our target audience, our majority of our listeners are parents, we do have a ton of docs that tune in as well. There's going to be information for everybody because he makes it so easy to understand. I'm actually going to be taking notes. So if you guys see me look away, it's because I'm writing. So welcome, Dr. Parker. I am so excited to have you here. What is up? Happy New Year.
Happy New Year, Dr. Dassani. Thank you for the kind words. You're always so sweet. It's a
Oh,
pleasure to
I
be
almost
here,
forget you.
and it's a great start to 2023. I watch the news and everything's kind of doomy and gloomy and recession and all that, but I can't help but think, our lives and our practices and our experiences are really kind of what we make them. I'm super excited for 2023. And even if there are challenges, I think it's going to be a great year. I really
It
do.
is. I can just feel it. It's going to be amazing. So let's dive in. And you are a dentist. Of course, I know that. But for our listeners, but tell us how you got into lasers. Why lasers? Still.
Yeah, so I've been using lasers for a long time. I started in 1998 using lasers. That's a few years ago. Back then, you could buy a diode laser. That was really kind of our only option. There were a couple other things, but really that was it. So I started there and went through three different diodes before I realized that's really not the solution I'm looking for. I've done a ton of surgery using diodes, and in hindsight, I kind of cringe at my results because while it was better than my alternative, it's not the same as the alternatives that we have today. So I bought my first CO2 in 2003, at the end of 2003. There was a company that brought in 5 super pulsed CO2 lasers into the country. It was the first time we had really a super pulsed CO2 in the country. And I was one of the first 5 that bought them together. And that laser, ironically, still works perfectly today. And that was a Deca CO2. Amazing technology, amazing company. So that was kind of my start. I also had an ND YAG. And so I'm familiar with pretty much all wavelengths of lasers. It's a great world out there.
Yeah. So for our listeners, um, these are the two lasers that I use within the practice as well. I use the Nd:YAG extensively, gotten into the CO2, and I'm loving it. It gets rolled into the operatories, the different ops that I work in, different patients for different uses, um, almost every single day. And between Jennifer, our hygienist, and myself, those lasers get utilized a lot. So, Dr. Parker, tell us, what is the big deal? I mean, I know what it is, but what is the big deal with the CO2? Um, why a CO2 over another laser? And just for our listeners, this is not a promo for any laser. Like I said, I own a
Agreed.
multitude of lasers. We're just talking about why one particular wavelength is preferred by both of us, Dr. Parker and myself, for certain procedures. And this is just so we understand there is no one size fits all. There is no magic wand, as much as I wish for there to be. What works best in whose hands and for what clinical situation? We don't take a hammer to everything, do we? So tell me, Dr. Parker, why the CO2? Why do we love it so much?
Thank you, Doctor. It's really, really, really important that people that are listening understand that. There's this misconception that there's one laser that can solve all our problems. That's not realistic. We just can't do that. And an example that somebody told me once is it's like having a half a blanket. You can either cover your head and your body or your toes in your body, but you can't cover your head to your toes. It's the same with lasers. They don't do everything. So it's really important to understand that. Marketing today, whether we hear it in TV shows or on magazines. It's not realistic. It really depends on what we're doing. And the procedure, it's very specific to a procedure. If I had an infant coming in to do a tongue tie, there's only two wavelengths that I would even consider using for that now at this point in my career, and that's a CO2 or an erbium, because they both have an affinity for water, which means less pain for our infants. Now, the reason I would choose a CO2 over an erbium is because it's a much faster procedure. So our infants are feeling discomfort. I would rather that be done in 10 seconds than 50. Both are adequate, both are acceptable, but I don't want that infant to feel any more pain than they have to. So that's why I would choose a CO2. And that's why I think it's a really an ideal tool for releasing a tethered tongue, opening up those airways, letting that child develop in the manner that they're supposed to.
Right. And especially for our infants, because you mentioned infants, our babies that have trouble nursing, latching on, aren't able to eat. I mean, they don't ask for much at that age, do they? Just a dry diaper and a full belly. And if they cannot get that, let's make sure we can get it to them with the least amount of discomfort so that they're able to actually grow and sleep and thrive, and actually be the best versions of themselves as they're growing up. What are the procedures that you end up using a CO2 laser for? Where do you find it's best used? And then we'll come to where would we not use it. But let's get into that.
Yeah. Let me make a comment when you were talking about lactation and nursing, and then I'll address your question. We were speaking with an IBCLC who does these tongue ties all day, every day. She's in
That is
offices.
a lactation consultant for our listeners.
Thank you. She was telling me that she can actually hear the difference in infants' cries depending on the different lasers being used, and that the CO2 is far less of a stressful cry in the infants when those are being used appropriately. I thought that was interesting. So I think that's good background information. And if I was a parent out there and hearing this conversation, that's one of the first questions I would ask is, what's the pain level my child is going to experience? And the answer is, well, they're going to experience some, but it's much lower when we're using the right laser, which in my opinion is the CO2. What are the procedures that we can do with CO2? Well, now we're talking specifically to, say, the clinicians out there. A CO2 is a very versatile tool. So any procedure that has soft tissue, basically any procedure inside the mouth that has water, mucosal tissue, is very easy to use a CO2 laser. So we use them commonly in our periodontal therapy. So not only my periodontal patients, but my hygienists use these during cleanings to give a greater extent of disinfection or cleaning of the mouth. I use them all the time for my restorative procedures, to clean up excess gum tissue, to balance cosmetic cases. We do these a lot for releasing tongues, but also for removing fibromas. If you bite your lip and you get the bump on your lip and you want to take those off, we can do that easily. Very, very little postoperative pain, very quick healing, very easy procedures to do. The magic of a laser in doing those procedures is that we're sealing off three different things when we're using them. Not only are we disinfecting when we cut, but we seal off blood vessels, so there's very little bleeding. Not zero, but very little. We're sealing off our nerves, so there's less postoperative pain, which is a huge bonus for our patients and our infants. But we also seal off lymphatics, which are what are responsible for inflammation. So there's less swelling, less pain for our patients, but for us, we work in a cleaner field so we can deliver a better result. Really, really nice to have those options. And I think the benefit for our patients, speaking as a clinician, is dramatic, just based on what I've seen over all the years.
Yeah, and this is why I love chatting with you, because you spoke 3 sentences and I wanted to jump in like 6 times to go like, see, did y'all hear that? Make notes. But, for our parents that are listening, um, anytime the periodontal therapy is you're getting a cleaning or a deep cleaning, for the hygienist to be able to go in and disinfect those pockets is huge. Let's not forget that when we carry periodontal pathogens, the bacteria that can cause periodontal disease, we can actually transmit them to our kids. We can actually give it to our babies, to our infants, our toddlers, to whoever, by the simple
Absolutely.
act of kissing, sharing utensils, sharing food. And why would I not want the pockets disinfected when I am taking the trouble to go in and have treatment? So make sure that, these are conversations you're having with your healthcare providers. We've been doing this in my practice since the day I took over the practice. And like Dr. Parker said, one of the first lasers I bought was the diode, because that is what we had and that is what we used. And just while we're on the topic of diodes, I have a friend who is huge into, she has a practice that is committed to releasing ties and all of that. And she always says using a diode to release a tie is like cutting with hot glass. Do you agree?
100%. In fact, that's all it is. We're
Correct.
not using it as a laser in that case because we actually put a little uh, color on the end of the glass that doesn't allow the laser beam to transmit beyond that. So all of the energy collects in that quartz fiber and it becomes just a hot piece of glass. We're literally just melting through tissue at that point. We are not using it as a laser.
Right. You are
Very
burning
important
that.
that we understand that. Yeah.
Correct. And the huge, huge benefit of the laser, which is why I am such a fan, is what you said earlier. You're sealing off those blood vessels, so minimal to no bleeding, which is huge. I know that's the number one question that I get asked when we have a patient in the chair, be it a child, be it an adult, well, even the parent. It's like, am I going to bleed? Will I need stitches? How much is it going to hurt? Well, if you're addressing the nerve endings, that's less discomfort. And like you mentioned to our babies, it's, why would I want my child to be in any kind of discomfort post-operatively? Is there some? Of course there is. This is not the
Yes.
magic wand. But if we can minimize it, I definitely want that option, right?
Absolutely. And I have three children myself, and I watch what they go through after maybe it's a procedure, maybe it's bumping your knee. I mean, as parents, it kind of breaks our hearts to see our kids when they're in pain. And so, our job, I think, as a parent is to watch out for our kids. We all go through pain, but we don't intentionally seek it out. That's not really the way we're programmed, right? So
Right.
anything we can do to mitigate those types of things is good, especially when it comes to them sitting in my chair because they got to come back 6 months later and we have to see them. And I want them to have a great experience and I want them to have fun when they come back. It's always good to be able to do that.
Would you agree that healing is faster after a laser as opposed to um, the traditional way of releasing a tongue tie? For example, using a scissors and sutures is still a very valid option. And it is
Yeah.
sometimes the right option for certain cases. But when, you compare side by side, do you agree that laser wounds heal faster?
I do, for a couple of reasons. And this is actually very important that we understand. Um, Lasers are disinfecting as they're cutting or as they're releasing. We're literally sterilizing a site. Now, we can't sterilize a mouth, right? Because that's really not possible. However, we can dramatically reduce bacterial loads using lasers. But when we're doing that procedure, we're basically sterile in the field that we're working in. So that's a huge bonus right there. So that's one reason we heal faster. The other is wavelengths of light stimulate our mitochondria. Our mitochondria are the little powerhouses inside of each of our cells that tell our body to heal quicker. So by stimulating the mitochondrial process, we actually accelerate healing. We also find, Dr. Dassani, that when we use certain lasers, we develop less scar tissue than traditional. CO2 and erbium lasers are famous for very little scar production when used appropriately. There are some people out there, other laser companies, that are saying CO2 creates scar. That is absolutely incorrect. And that's been documented multiple times in research. So if anybody ever says something like that, it's just, hey, show me the research that supports that, and I'll show you somebody who doesn't know how to use a laser. Not only do we accelerate healing, we see less scarring, which means a better final outcome as well. That's critical in tongue tie release, by the way. If we're developing scar tissue under the tongue, we're no better off than when we started. So
We're actually
really
doing
important.
a disservice. Yeah, it makes everything a lot worse.
Yeah.
When would you not use the CO2? What are the situations where you'd be like, nah, this is not the right laser for me?
That's an interesting question, because in my hands I've used it for so many different things. It's hard for me to think of. In general, I would say one contraindications for lasers overall is, say, a patient that comes in who's COPD, who requires medical concentrated oxygen. Maybe they're wearing a nasal cannula. We want to be really mindful of those patients, because we can spark a flash fire, not because they're on medical oxygen. It would only happen if there's something flammable in their mouth already. Mm-hmm. So whether that's a piece of dry gauze or something like that. Lasers and oxygen will not ever spontaneously combust. We have to have certain things in place for that to happen. So they're very, very safe today. We just don't really see problems. You can, but you have to blatantly ignore rules, which anybody that uses lasers is aware of, or should be aware of.
Yeah.
So very,
it's
very, very
training
safe.
Protocols, yes. Anything that we're taught. So what I'm hearing is there are no true medical contraindications to the use of lasers in infants and adults.
Not with CO2. We do want to be mindful with erbium lasers of pacemakers. And the reason for that is erbium lasers. Erbium lasers are what we use on, say, hard tissues, if we want to cut hard tissue with an erbium laser. And there are some CO2 lasers that cut hard tissue as well. We can ramp these up high enough that they create a pressure or a shock wave. It's like hitting a drum membrane. If we get those high enough, those shock waves could alter, say, a pacemaker. So we want to be mindful of that. But in general, there's no real major contraindications for CO2 laser use.
Okay, perfect. There's something very cool with my laser that I absolutely love. Yes, I love being able to do the releases. And I'm done before I was like, I didn't get to enjoy holding my handpiece as much. I was done before I realized it, which is amazing. But I am absolutely loving the attachment, the handpiece that I use for snoring for our patients, for our adult patients. Talk to me about it, and we'll address it from two different perspectives. Talk to our parents first, what it does, what it can look like, benefits, what they can expect, and then let's geek out over as doctors. It's like, what are we seeing changes? So let's talk about that.
So I love this. This is one of my very favorite things to talk about right now, because it's not new, but it's still fresh. But it's changing people's lives, literally changing lives. So for me, this is really exciting stuff. What you're referring to, for those that aren't as aware of it, we call it our Quiet Night handpiece. And what we do is we take a single beam of laser light and we fractionate it into about 100 little tiny pinpoints of light. It's called a fractional laser. Fractional lasers have been available in medical market for years and years. We use these to do facial aesthetics. So we could use a fractional laser on the surface of the dermis and create a more youthful skin. It does two things that are really important. Each of those little tiny pinpoint holes respond by healing up and tightening together. So we get an initial tightening of the skin, but down underneath that layer, we also stimulate new collagen. It stimulates the fibrocytes, which release high hyaluronic acid, and they convert into fibroblasts, and they create all new collagen layer. So this has been going on for a long time. We've recently started adapting this into dentistry because we realize that people that, say, have a snoring issue, people that snore at night, not to say that I've ever done that, but I know somebody who has.
Or me.
I'm kidding, because my snore score said I was basically like living next to a freeway. And so we treat the soft palate with this fractional laser energy, which you've experienced, and we get an initial tightening of the palate, which absolutely and dramatically changes not only our speech perception, which is wonderful, and I don't mean for the negative, I mean all of a sudden the tone of our voice just feels better, it feels richer, it feels more like it should. Because we've tightened up that soft palate. The drum head, if you will, I'm a drummer, so I speak in music terms. The drum head has been tightened, and so it resonates better. But after that, our collagen tone improves too, and so what may have been kind of a boggy or a flappy soft palate, which is why we snore, the tone of that improves, so we actually reduce snoring. One of my friends just sent me a before and an after recording of his snoring, and one of them sounded like an airplane taking off, and the other one, you can't even hear it because the microphone is trying so hard to hear something in the room that you can hear the fan in the background and a little whisper of a snore. And so I would imagine the decibel level of that probably went from a 70 down to maybe a 5 or a 10 decibels. Which is a dramatic decrease, which for any partner that's listening to this who has somebody that may or may not purr beside him at night, this is a great, great solution to that. But there's something else that's really interesting that happens as well, and I'm already geeking out. So you get me on this path and I won't shut up, so you're just going to have to interrupt me.
No, keep going. I'm taking notes.
The other thing that's magic about this is we actually can dilate open the airway as well. We're seeing a dilation of the airway where people who may have been trying to breathe through, say, a McDonald's straw now have a bigger aperture opening so they can breathe better at night. It's really been an amazing shift to see just how much we can change. So that's what we're doing right now. We call it Quiet Night, but it's sleep therapy using lasers. We particularly focus on snoring, but it is actually altering people's sleep as well for the positive.
Yeah, it certainly is part of the protocol within my practice. So for our listeners, remember in previous episodes, we have talked about how when you're snoring, there's inflammation that's a partial obstruction of your airway, right? When we're laying down, our muscles relax, all of the muscles in our body, and that includes the muscles in the back of our throat as well, and they fall back, creating that complete or partial obstruction. Now, with this technology, when we're able to impact the amount of inflammation, because when you snore, that vibration does increase inflammation in that uvula and the soft palate, and you're causing it to tighten up, which means it gets smaller, impacts the size of the airway, right? That's the gateway to our airway. That's overall results. You obviously have a happier spouse that's not going to kick you out onto the couch, but you're waking up feeling more rested, and there's just more oxygen getting to your brain. So that's amazing. Like I said, it's part of the protocol in my practice. I've actually had it done because I wanted to see what it felt like. And yes, my good friend over there was the one that was brave enough to try and treat me. But we forgot to mention one thing. Talk to me about the effect on the tonsils with that fractionating, tell me the word again, handpiece.
The fractional handpiece.
Fractional, thank you. Yes.
Doctor, have I shared with you the photograph of the tonsils?
You have.
It's unbelievable. Do you have it on your site? Because we should post this on your site or on your wherever you have your social stuff. I can send you that so you can share it. But for those of
That
you
would be
interested,
amazing.
I have a before and after shot, 1 day post treatment of the tonsils. This actually was a doctor whose tonsils were severely inflamed, and you can even see tonsillar stones in there. We treated it the next day, the tonsils were shrunk by more than 50%. And the difference in the ability for her body to assimilate oxygen is just dramatic. She noticed it immediately, obviously. So, what we're doing, and this is important to understand, is we're not actually removing tonsillar material. That's the job of an ENT. That's not within the scope of a dental practice. However, it's very much in our scope to disinfect surfaces, which is what we're doing when we apply this. So we're disinfecting the surface of the tonsils, which are definitely infected. That's why they become inflamed. You just explained that. So when we treat that tonsil, we can actually shrink these by half almost overnight. Dramatic difference for people who've suffered with chronic inflammatory problems with their tonsils. Really just an amazing difference, remarkable difference.
Yeah, for sure, for sure. Just if you think about it, everything ties in. There is no standalone treatment for anything. Because we just a few seconds ago, I mentioned the soft palate, right? But then when you have a child that is a mouth breather, that has a tie that is possibly contributing to that mouth breathing, snores, has enlarged tonsils because while they're mouth breathing, their tonsils are doing the job of what the nose should be doing. They're caught in this huge cycle. Yes, you're going to help the child with myofunctional therapy, with addressing the tie, but imagine the relief. Your ENT evaluation this is not a substitute for it. So just a disclaimer there. You always still need your ENT eval. That's
Correct.
part of our protocol. We're not substituting one for the other. This is an adjunct. This is an adjunct to, it's like you got to eat healthy, you got to work out, you still got to take your vitamins. And that's what this is. We are creating a system where everything fits in together. We want the ideal outcomes as quickly, as easily for our children and our adults. So all of this just flows into each other. There is no, I can't pick and choose. There is no menu items for me to say, I will take the tonsil shrinkage without seeing the ENT or without addressing X, Y, and Z. Am I on the right
Such
path
a
with this, Dr. Parker?
such a spot on explanation. I think in our world today, we're so focused on the one solution for right now. I need to solve this and I need to solve it right now. That's just the society we live in. However, our body is an incredibly complex machine, and that's not the way it works. There's so many factors. I talk all the time when I do this about when's the last time you had your hormone levels checked, because that's a factor. What's your weight? What is your plan to manage your weight? Where are you at with your engagement of your brain? Are you making sure that you're staying ahead of all these things that can become a problem? As a youth, we just don't think about those things because we're immortal still. But as
Yeah.
we get past into our 40s, we start to realize, hey, my body's starting to hurt. Things are changing. I don't respond as quickly as I used to. I think I told you I'm a bike rider, and there's years where I'll ride 6,500 miles in a year, and I just didn't recover as quickly as I used to. Now, since I've been addressing the hormone levels and all those different things, my oxygen saturation, all these different components, which are all part of us as a machine, it's made a tremendous difference in how I recover. The next day I can walk again, where before I'd be kind of sitting on the couch saying, I kind of hurt. So really important that we address the big picture. And to your point, I would never consider treating a tonsil and calling that done. I would always refer him to an ENT and say, you probably should consider getting these out. Doesn't mean we won't still need to use use the laser in those areas, but it's important that we work synergistically with our other specialties and subspecialties.
It truly does take a village, especially to treat our kids. You know, the more we are in tune with all the other providers that can help our kids actually get better quality sleep. It's amazing what we're able to see these kids turn into. It's like suddenly a switch is flipped, and I always say, you know, we're in the lucky position, the envious position of the dental providers being quarterbacks. We get to be in there and monitor and find our team for our patients to be able to get the quality of care. Before we wrap up, let me switch this. So as we wrap up, let's say that what are your top 3 tips for doctors, and then what are your top 3 tips for our parents that are listening in?
For doctors that are interested in lasers, I would ask myself 2 questions. What is my primary scope of practice? If I'm doing general family dentistry, I think a CO2 is an incredible solution. It's cost effective. So I guess the question would be, what's the most cost effective solution? I've found that a CO2 will pay itself off if you're doing it correctly in less than a year. In my case, it was 8 months to pay mine off because I used it in hygiene, but I also used it for all my other procedures. If your scope of practice is surgically based, that's a no-brainer. There's no other tool I would use than a CO2 for a surgically based practice because it's the most efficient laser for any surgical procedure. If your practice is based off of periodontal procedures, I would consider a CO2 or an Nd:YAG. Those are really the only 2 that I would consider. In my practice, the reason I wasn't a big fan of hard tissue lasers is because I couldn't figure out the ROI. For parents listening, as dentists, we have a business that we have to run, and if we buy tools that don't pay for themselves, then we can't buy those tools because it's just an expensive toy. And so those factors come into play from a business perspective, and anybody that's in business will understand the value of an ROI. For parents, the question I would ask if we're seeking to do any procedures is, what's the best thing to manage my child's airway? Everything today as a parent should be focused on the health of our child's airway. Because we're learning so much more about the impact that a healthy airway has on the growth and development, mental development of our children. Physical growth, but also mental growth and development. When our children are getting enough air and oxygen at night, we're not seeing problems with bedwetting, with attention deficit, with all these other things. Now, that's in an ideal world. There's obviously other things that are factors, whether it's chromosomal or things like that. We can't change those chromosomes, but we can change the air volume that our kids are getting at night, and we should. The other question I would ask is, who are the clinicians that are leading the charge for this? And those are the people that I would seek out today. I would certainly want to take my child to an expert if we're going to go get a tongue tie. Somebody that's using, say, a CO2. I would never, ever in a million years recommend a child get a tongue tie release with a diode laser. I just wouldn't do it. So for anybody listening that's concerned with their children, have an evaluation done by somebody who's a specialist. Reach out to Dr. Dassani's network of clinicians that follow her, that follow the things she recommends, and look for those people that are trustworthy, that follow this technology that can offer those services.
Thank you. And, you know, just as to tie in what Dr. Parker just said, our goal should be to build the foundation for our kids' health. All too often, and I think it's society, it's what we've been trained to focus on so far, is that's all everybody wants, is straight teeth and white teeth, right? It's like, I want pretty teeth, I want a beautiful smile. Yes, that is important, but especially when we're dealing with kids, let's build their foundation first. I told a mom just today, let me fix your child's foundation, aka airway, the jaw, the supporting structures. We can buy furniture later, which means we can fix their teeth, we can make them wider, brighter, straighter, whatever your goal is, once I have a strong foundation. I don't want to build a house on a cracked foundation. I want to buy furniture after my foundation is fixed. So I think that ties in beautifully to what you just shared.
It's a great analogy. I love that. And parents out there, if your orthodontist recommends extraction orthodontics, realize everything's going backwards, run. I'm sorry, I'm very opinionated about that one.
It's all right. I am too. I always tell parents this, ask why. Well, I tell doctors this too, ask why. And when you get the answer to that why, ask why again. Dig deeper. And if somebody tells you if you're not happy with the answer, if your gut tells you that there is a different answer, go get a second or a third or a sixth or a 65th opinion. It does not matter. Yeah. Nobody knows your child like you do, and don't stop until you have an answer.
Yes. And it's okay to do some background research too.
Oh, for sure, do background research. Absolutely. Yeah. It's our kids. Absolutely.
It's our kids. It's worth it.
Totally. Awesome. Well, thank you so much. As always.
It was great to chat. Yeah.
It is a pleasure chatting with you. And I will have all of Dr. Parker's contact information, all the coolness that he does in the show notes. So you guys know how to reach him, how to get a hold of him. And he's an amazing human. So I am so glad I got to share him with all of our listeners today. As always, hit the share button, hit the like button, and I will see everybody next time.